We have a couple of COVID orders that are expiring that we are going to re-up or that I have signed an extension for. I want to go through 3 of them. So today I signed an executive order renewing the facial covering mandate in Kentucky. We know that this is one of the most powerful tools to fight this virus. In fact, many months ago, I was in a car. The driver was positive at the time. We didn't know it. Both of us wearing masks. I did not contract the virus. Neither did my family. This protects you. At a time where the virus is spreading in just about any enclosed space where people aren't wearing masks, this protects you. So we're re-upping this. And I need people out there to try. I need them to do their duty. I need business owners to enforce this. Restaurants and bars, part of being able to operate in a pandemic that spreads when people take their mask off is to make people wear them every moment that they are not eating or drinking. Please, everyone, this, more than anything else, is going to decide how many people live and how many people die. So wear your mask. We just got through Christmas, where we see the example of sacrifice at a level that it's even hard for us to understand. And given that example, that started with that child on Christmas and went through crucifixion, can't we, in the very least, wear a mask for our fellow human being? Please, whether it's your faith or your values that call you to wear that mask, wear it. So the renewal takes place at 5 p.m. on January 2nd and will last another 30-day period. Today, I also renewed the executive order allowing pharmacists in Kentucky to dispense emergency refills of up to a 30-day supply of non-scheduled medications for residents of the Commonwealth. This will add 30 days on to January 4th, which it re-ups for that next 30 days at that point. And finally, as a part of this new CARES Act that was passed, the CDC eviction moratorium was extended through the end of January. So yesterday, I signed an executive order that extends our moratorium on evictions to match the CDC's. And we're going to talk about eviction relief right near the end today. All right, let's talk about vaccines. Again, this is incredibly exciting. This is how we're going to defeat COVID. We're going to need everybody to take this vaccine. We're going to need you to have patience. It's the hardest test of patience we're going to face in our lifetime. And the reason we need you to have patience is we don't have that much vaccine compared to our population. And it's going to take time to get enough to open it up to everyone. Remember back in testing when we had to ask people to wait? That's where we are now. But remember, we got to a point and faster than we thought where we could open up testing to the general public, anybody who wanted to get one. We will get there in the vaccine, but you got to give us time to build it. Just like there wasn't a test in existence, and we had to create the network of testing, going from one state lab to hundreds of locations all around the Commonwealth, one convenient to you. We will get there on the vaccine. But remember, we're signing up providers that have never given this vaccine before. It's not some electronic transaction. It's an individual that has to vaccinate and enter it into a computer system afterwards. And so it's going to take time to build up that provider network and to get the data back in real time about who's getting vaccinated and those exact numbers. So again, we got to build this airplane while we're flying it, and it's got to be the most complex airplane in terms of vaccine logistics that we have ever seen in the Commonwealth or across the country. So here is the schedule that we have shown you on the December allocations from the federal government. Today, we got our next set of allocations for the first week of January. So Jim, if you could show that. So Pfizer allocation will be $27,300. Remember, we send a significant portion of that to the long-term care program run by Walgreens and CVS. The Moderna allocation goes out primarily to those healthcare workers, EMS, EMTs. So we're going to receive another 53,700 doses. These are the original doses in that next week. Again, this is not enough to get through that first grouping, but we want to show you in full transparency how much is coming and when. And I think we have an update on CVS and Walgreens program as of today. Today, Walgreens really got after it, and we appreciate them for that. They provided 1,009 vaccines today. That is both to long-term care residents and the staff. And I believe this is 20-something facilities, which is great in a single day that they were able to reach out to. That's the kind of effort we need. CVS did less than half, 501. But we believe that their program is going to increase in volume. We need it to do so. We've contacted both, and we have asked them to work through New Year's Eve and New Year's Day. How fast you can get these into people, especially in long-term care, absolutely will save lives. So we've got to continue to push. For these companies, remember they've done vaccines in these areas before, but this is an entirely new program on an enormous scale. So we are working with them. We know there will be hiccups. What we want to make sure we see, and what we think we're seeing, is significant effort by both companies. We believe that they are good partners, and we're going to continue to be there with them every day to push when necessary, but also to praise. This number by Walgreens is a really good number today.